Hi, everyone. Welcome back to the Integrative Health Podcast with Dr. Jen. We're going to be talking to Dr. Debbie Ozment, and we're going to be talking all about oral health. It will be so fun. Dr. Debbie Ozment has a private practice dentist since 1985. She's been in practice for almost 40 years. A graduate of Oklahoma University College of Dentistry, she served as adjunct faculty there for 7 years. Dr. Ozment completed a master's degree in metabolic and nutritional medicine from the University of South Florida, Morsani College of Medicine, and is a diplomat with the American Academy of Anti-Aging Medicine, or A4M. Trained at Mayo Clinic, she is nationally board certified health and wellness coach. She is the host of the podcast Vitality Made Simple, committed to sharing practical, understandable, and fun strategies to enhance your vitality and health span. Dr. Ozment is committed to early diagnosis and intervention of periodontal disease to positively affect not only the mouth, but the entire body. Welcome, Dr. Debbie. So excited to talk to you today.
Thank you, Dr. Jen. It's a joy to be with you.
Yes, and I love that you are on this mission to fix everyone's oral health, because as we can know, the mouth and the gut and the whole body, it's all connected. And some people talk about gut health, but they ignore their teeth. So how did you get from conventional dentistry to now what you do, working with the whole body, starting with the mouth?
It was really curiosity, Dr. Jen. I had this sort of boutique practice. I'm very relational, knew my patients, and I started just noticing, 35 years ago that people were collecting medications, and they were, you know, having longer and longer lists of these uh, chronic meds, things they would be taking forever. And that sparked my curiosity. But also, I noticed that people were the people that had really healthy oral microbiomes. I mean, this is before we had oral DNA testing. They were faring better. So it was just sort of, like, what in the heck is going on? And in dental school, we're very trained as carpenters. I mean, we're good at fixing teeth. In fact, I know you're a mom of 4 kids, and when our daughter was in kindergarten, her teacher, was saying, "What do your parents do?" And she said, "Well, my mama is a laundry lady and she fixes teeth." And so, that was very
Love it.
accurate to be laundry lady, for sure. First, the thing is, though, we tend as a profession to look at teeth, save teeth, and focus on teeth. But as I started like digging in and going back to school and realizing this oral microbiome, it's not staying there. It's really not about the teeth, Dr. Jen. It's really about, chronic inflammation that's all over the body from head to toe. And when you think about the gut, it's this long tube. So, the health starts in the gut. We know that, but the gut really does start in the mouth.
Yeah, it does. And people just go to their dentist for their dental cleaning, make sure they don't have cavities, they brush and floss, and it stops there. And I guess my question for you is, what is the biggest misconception about oral health that you have noticed with your patients?
The very biggest misconception, and I fueled this in the early days before I understood the vast importance. The misconception is that a little bleeding is okay. So so we go to the dentist and it's like, oh, especially someone like you. You're gorgeous, you're kind, you show up on time, you pay your bill, you've got beautiful teeth, and it's like, oh, Dr. Jen, you have a little bleeding, no problem, see you in 6 months. And so or they'll say, oh, or I said it. I mean, I did this. I made this mistake. Um, oh, brush and floss more, brush and floss more. Oh, where are you going on vacation? Just kind of just ignoring this early sign of infection, actually. So, so that's really my mission, is to tell people you've got to know that if there's any bleeding, you've got infection, and that is traveling all over your body, and it's inhibiting what you want to do in your life. It's inhibiting your relationships. It's going to cost money. It's going to, keep you down and keep you from fulfilling your God-given call and your dreams. And it's a much bigger deal at the early stages, Dr. Jen, than we ever thought.
Interesting. So a little bleeding in the gums, because I mean, really the last probably decade hasn't happened to me much, every once in a while, but rarely. But you go to the dentist and it's happened with my kids, maybe we've been slacking as, parents, making sure they're actually flossing when they said they floss. And then you get in there and you do it, or the dentist, and you get a little bleeding. And they're just like, oh, it's because you're not flossing. That's why you're having that bleeding. So that's not true. Could you explain a little bit more about this bleeding?
Yes, an epiphany happened to me in about 2004 in Nicaragua. I was on a medical mission trip, and on those trips, we take extraction instruments. I mean, it's people line up, and it's all extractions, and you can always tell somebody has a toothache. They'll have, they'll be holding some, rag on their face, and a few people came in that didn't have a toothache and just said, I just want you to look at my teeth. And they looked fantastic. I mean, their gums were super healthy. Now, this is in a place where there's no fancy toothpaste, there's no fancy mouthwash, toothbrushes, super, super needy. But these people there were a few people who had these incredibly healthy gums, healthy oral microbiome. So I'm like, what are you doing? Well, they were getting a little twig and, peeling off the rough stuff and making what they would term chew sticks. So they would get these little chew sticks and scrub between their teeth. And it just sort of lit the fire, Dr. Jen, of like, okay, they're actually disrupting that biofilm. This is amazing because it wasn't about money. It wasn't about dental care. It was just about a daily home routine that made a lot of difference. Flossing is great. I'm not against flossing at all. I floss my teeth, but it requires some dexterity, and especially safe for your children, or lots of people have, dexterity problems. And they'll people will used to tease me, and they say, well, I'm just flossing the front ones, that's all that matter. And because the back ones are hard to get to. But with a little brush, so I came home and started looking for some, options, found these little doctor's brush picks. Now, 20 years later, 21 years later, I have little tools that I recommend for people that help them actually physically disrupt the biofilm that's living between their teeth, under the gums, in a concavity, really, something that maybe floss might, uh, floss over. So it's really simpler. I think it's simpler than we make it.
Yeah. Yeah. So kind of to break it down like a biofilm, I might have you explain that a little bit more, but I like how you said how they're in the crevices. So think about the worst place to clean in your bathroom, right? Behind the toilet, right? Like that's like a tooth, like it's hard to reach, and then the stuff gunks up. So could you explain biofilm? Some of our listeners might be, they might know what biofilm means in the gut, but they might not know that we could have biofilms in the teeth. So, and you're saying when that biofilm is being disrupted, you're getting the bleeding basically. And then that's going into the bloodstream, or
Well, partly, boy, you're so insightful. It's the behind the toilet is the perfect analogy because, that's where things accumulate. So think about this tooth having this concavity, where the bacteria produce toxins. These toxins can calcify. So it produces this kind of calcium, matrix that you get hopefully cleaned off when you go to the dentist. But to produce that, the bacteria live in a biofilm. A biofilm is like a collection, a community of bacteria that that help protect each other. So they're living in this protective biofilm. They secrete different chemicals that help help them protect each other. They help each other grow. They provide food for each other. So that's like a little community living there that produces inflammatory cells that get into the bloodstream. So whether you disrupt it or not, you're absolutely getting those bacterial byproducts in the bloodstream that are, increasing inflammatory cells, triggering the immune system. But you're also getting those bacteria translocating to other parts of the body. That's what's so interesting about, the salivary diagnostics these days. We can actually test and know what the DNA of specific bacteria that are in other parts of the body. So the key is to keep it disrupted. It's going to bleed for a while, but eventually, Dr. Jen, healthy gums don't bleed at all, ever. You can't get them to bleed. That's the key. That's what we all want is gums that we cannot make bleed, whether we get our teeth cleaned anytime. They are so healthy that bacterial biofilm is keeping is gone. It's gone every single day.
Wow, that's cool. Well, what is your routine? Just curious, because everyone probably is wondering, like, well, I wonder what Dr. Debbie does. How do you clean and take care of your teeth? What's your routine?
Well, I'm very simple, Dr. Jen. I mean, here I am, 66 years old, and I think I'm getting simpler by the day. So I brush my teeth, of course. I use a toothpaste that I don't think the toothpaste is super crazy important. I think it needs to not have fluoride because we know that you're the expert here with thyroid health. We know that fluoride can disrupt the thyroid gland immensely. So I stopped using fluoride 25 years ago when I learned that. Also with a toothpaste, look for something that does not have sodium lauryl sulfate (SLS). You want to avoid that. If you can, there's remineralizing toothpaste. There's great ones out there. Biocidin has a good one. There's lots of good ones. I don't represent any certain toothpaste, but also look for something that has xylitol if possible, because that's has been studied for specific bacteria that we see in the mouth. So I brush my teeth and I floss my teeth. Then I use these little brush picks. Oh my goodness, I'm sorry I don't have one right here. They're just little gum picks that you can buy anywhere. They're green and white and they're curved and you can really get in there and scrub. And I mean, you want to get in there and scrub just like you would behind the toilet. I mean, I love that word picture. You want to scrub, scrub, scrub because you're removing like barnacles, like barnacles from a boat, scum from the bathtub. You want to keep that gone. And then I've started doing something really interesting in the last few years, and I'm doing oil pulling. And
Mm-hmm.
so I did an experiment on myself. Did a saliva test and then did oil pulling for 30 days. And I put a couple of drops of Nigella sativa black seed oil in my coconut oil and actually looked for how that impacted my oral microbiome. And there was it was significant. It was 30% decrease in a specific bacteria called Fusobacterium nucleatum. That's really my area of interest is Fusobacterium because it is being shown to be causative of colorectal cancer. So we can really change people's health trajectories by dealing with the oral microbiome, and hopefully, I want your listeners to know it can be pretty simple.
Wow, I love that. So I want to get some of those little brushes. I've seen them, but you're right. Like you're flossing back in the back teeth. You're not really getting that off. And that's where it kind of sits. I do love oil pulling. I oil pull with coconut oil and your gums like shine after and it whitens
Yeah.
your teeth. It whitens your teeth too. So sometimes like I'll slack off and I feel like I was really good. Like I think I started oil pulling like 10 years ago and I was like so good and diligent. And then the more kids I had, because you can't talk when you're oil pulling. And then like you try to talk and some spits and dribbles out onto your outfit and it's coconut oil, so it stains. Anyway, so yeah, I agree. I love oil pulling. But okay, what are your opinions on this? Because I tell my patients or whoever asks, don't oil pull if you still have amalgams or mercury fillings in. What do you think on that?
I I think it depends from what I've seen, the size of those amalgam fillings, because some people have little tiny ones that really don't, they're not hitting when they chew. Uh, but I think that's good advice. I think, overall people need to be getting their amalgam fillings out. That needs to be done by a biological dentist who does it correctly. And and then it's like an peeling an onion. There's just all these layers, and that's one of the layers that's going to help people.
Mhm.
So, no, it's great
Yeah.
advice.
And one other, well, I think it's controversial because you just hear different opinions. What do you think about those dental picks, those like water powered dental picks? Do you know what I'm talking about?
Uh-huh.
Okay.
Well, I think the key is people know how they're feeling, what works in their hands. I don't think there's any one um, product that's going to solve this chronic inflammation in the mouth, because it depends on, if people have straight teeth or crooked teeth, or, crowns and fillings, and it just needs to, people need to be looking for bleeding. And then there are objective saliva tests that they can take, some that their dentist can administrate, some that they can do on their own. Like there's the bristle test. I'm sure you've heard about that. It's a shotgun genomic test. That's a simple saliva test that people can take it home and find out what's going on in their oral microbiome, as well as get some readings on things like nitric oxide, and even a reading on gut health with that.
Yeah. Well, can you talk a little bit more about these saliva tests and how you use them in practice?
Yes, Dr. Jen. Back in 2010, I went to a vascular inflammation class that was given by some cardiologists. The first thing we knew in dentistry was that the oral bugs, the bacteria in the mouth, can really increase the chances of heart attack and stroke. So that was in the 80s. That was early info. So it's like, okay, this class is being given by cardiologists. This is exciting. Well, at that course, they introduced a test by Access Genetics called oral DNA. And so, oh my goodness, I'm on it. I came home and tested everybody who would swish and spit, and it shows 11 different bacteria, and it's a quantitative PCR test. So not only do you see what's there, you see how much is there. And so I started doing that for all of my patients, family, some fantastic stories that came out of that. And that sort of started the deep dive. Now, I use that one in clinic, Dr. Jen. Recently, there's a great company called Bristle Health, and they have developed a shotgun genomics test that you swish, but you get a lot of different information. You get sort of you get a different type of information. It's not as quantitative, but great information. And they have such an incredible website and wonderful resources. And so that I've got a lot of information on my website about that, because I love it when people can be empowered to do things on their own. And I would encourage people to, if they do a bristle test, take it to your dentist and check out the level of curiosity that you find, because these tests are so well studied. I'm sure you've experienced this, Dr. Jen. You'll tell somebody something, and maybe on the less curious side of healthcare, it might be, well, there's no research. And it's like, oh,
Right.
goodness gracious. No, there's thousands, thousands, and thousands of research papers. And that's exactly where we are with the oral microbiome.
Yeah. And so, yeah, there's research on it, but also I think there's this problem where they're like, well, it's not, this institute or this society that I belong to, they don't recognize it. And it's like, well, it takes a long time for things to get into protocols. And it also depends on money and who, in the pharmaceutical companies and dentistry, I'm sure is similar to to regular conventional medicine. So yeah, and I think like you said, get the test on your own and bring it to your dentist, and maybe that will plant a seed. And then maybe in 5 years, your dentist will just flip into holistic dentist. I mean, this is how it's if that, like you said, you were curious. That's why you went from regular dentistry to what you do. It's that we want to spark curiosity. And so many people, I mean, they go to their dentist and they're still having problems with their teeth. And it's like, well, if it was working, wouldn't you have perfect teeth? So we gotta do that. And this is why people are listening right now, right? Because we're doing the research outside of that box that everyone's sitting in.
Exactly. Something also that just really, I guess, supercharged in terms of me going back to school was a case in 2013. A functional medicine physician sent a patient to me who had a super high C-reactive protein. And she had her C-reactive protein was 18.1. And that was in the days, Dr. Jen, when it wasn't just over 10. You know, you actually got to see a specific number. And the physician said, Debbie, I'm thinking she has cancer, but we can't figure it out. See what you think. So I did a saliva test, found out her, profile of pathogens, did not use antibiotic. Now, Dr. Jen, seeing her profile, I might. I mean, sometimes I do. Um, but nevertheless, what we did is a deep cleaning, used a laser, taught her home care techniques as I've described. And in 60 days, her C-reactive protein had plummeted to 2.9. So what we're finding is actually that probably kept improving, you know, on out, but that just happened to be the timing of her test. But what was shocking, absolutely astounding, is that other blood numbers moved. Her fasting blood sugar improved. Her cholesterol numbers, her lipids improved. Her whole blood panel, all this red went to yellow or green. And so that's when I was like, yikes, there's way more to this. This is not about the teeth.
Right. And that's amazing that they were sent to you for dental stuff, and it was the key to it all. And we can't ignore our mouth anymore. Like you were talking about fusiform bacteria. What's the correlation you said with colon cancer? And have you seen that actually, like in patients, have you seen the correlation, and how do you fix it?
Thank you for that question. I really appreciate that. Fusobacterium nucleatum is an oral pathogen, exclusively oral pathogen, that in the last probably, I'm going to say 8 years has been highly studied. I had the privilege of doing a TED talk in 2018, I think it was. But after that, several researchers started emailing me and saying, I really think Fusobacterium is a bigger thing than we thought. I don't think it's only increasing inflammation in the gut. I think it might end up being potentially causal for colorectal cancer. Well, now, Dr. Jen, we're finding this oral pathogen in about 50% of colorectal tumors. And the jury's still out on whether it's causal, but I don't think that matters. I mean, we want to get rid of it either way. We want to know it's there and we want to deal with it. So, we can, do a saliva test, and then we can do a GI map, which actually shows Fusobacterium. Now, some of the latest research is telling us that it might be also a subspecies Animalius, but the key is to get rid of it. And bleeding is going to be a sign of Fusobacterium. Now, basically, this bacteria causes havoc in the gut. I mean, it's not just colorectal cancer, it's all kinds of other things that I'm seeing. I'm seeing it high in autoimmunity. I'm seeing it high, especially in Hashimoto's. I'm seeing it high in adverse pregnancy outcomes. I'm seeing it high in type 2 diabetes, pre-diabetes. It's commensal bacteria. So when it's super low, it's not bad, but it's when it overgrows. It overgrows easily these days. I mean, something I've really been working on is trying to figure out why in the heck do more people have high fusobacterium now than they did when I first started testing, you know, 14 years ago. But nevertheless, it is. It and the thing is, it's pretty easy to get rid of, but it's been so highly studied, Dr. Jen. It's so interesting. In a real case that I had, a gentleman came in who had been diagnosed with colorectal cancer. He was wearing a chemotherapy pump of 5-fluorouracil. His He had mets in his lungs. His tumor was not shrinking. We tested his mouth, his gut, did a deep cleaning. Actually, used I used metronidazole on him because of his level of fusobacterium in his gut. Don't always use antibiotics, as I said, but the key through this journey, his colorectal cancer uh, started shrinking, and in researching, like, okay, this is I want to understand this more. I found lots of research talking about how fusobacterium actually causes some chemotherapeutic agents uh, to not work. It can cause these colorectal cancer cells to be resistant to 5-fluorouracil is one that's been highly studied. Another one that has been studied is cisplatin. So now we know that this simple antibiotic, as well as a good thorough, deep cleaning, which we call scaling root planing, really turn the corner for him.
That's really cool. And gosh, I mean, it's this whole nother world of looking at our gut microbiome and how it's affecting drugs. Because these guys are smart. And I think that's we don't give them enough credit for being so smart. Smarter than doctors, smarter than cancer specialists. So I think that that's great that you were working side by side, with his doctor and they were open to looking into this.
It's so impressive to meet curious doctors like you who are willing to say, wait, there might be more to this. There might be a door I need to open. There might be, a basement I need to look in. Because, it all translates to better relationships, for people to have more time with their families and to feel better, and to he had a big family, and it was just wonderful because his chemotherapy started working. Very integrative.
Yeah. Yeah. Are there any other case studies that come to mind over the years that you'd like to share?
um One thing for your listeners, I think specifically, is the impact of the oral microbiome on adverse pregnancy outcomes. I've been I've been shocked, absolutely shocked. A most recent case, a couple came to me who had been trying to have a baby, had done everything they can for 10 years. And literally, Dr. Jen, we just had to get her oral microbiome healthy to get rid of this chronic inflammation. Fusobacterium has been found in the fallopian tubes. It's also been found to be correlated with low birth weight. I mean, every problem you can think of. It's just crazy. And it's so simple. Nobody's named their babies after me, but I'm still trying. I think there's been about 7 though in the last few years of women who send me pictures. They'll send me pictures of their ultrasound, like at 4 months. Or one woman had 5 miscarriages, and so she sent me a picture of Hazel, 5 months in utero. So, those kinds of things. You just
That, that
wonderful.
is so cool. So fusiform has, and you said that's your favorite. Well, not your favorite. You actually don't like that bacteria, but that's the one you go after. In the fallopian tube, colon cancer, what else has it been?
Oh, some of the newest research is that it kind of propels a bacterium called Porphyromonas gingivalis. Now, Porphyromonas gingivalis has been studied intensely in terms of Alzheimer's disease, neuroinflammatory disease, multiple sclerosis, Parkinson's disease, specifically studied with Alzheimer's disease. There was a landmark study in 2012 where they found the DNA of Porphyromonas gingivalis, this oral bacteria in the brain of 40% of Alzheimer's patients postmortem. So it's big. But now we know that Fusobacterium actually fuels it. Oh, Dr. Jen, I jokingly call Fusobacterium nucleatum the mother-in-law bacteria because, and I can joke about mother-in-laws because I am one, but it is a bacteria that when it's low, it can be a beneficial bacteria. It's just when it stays too long. It's just when it starts taking over your life and, giving unsolicited advice and moving things around. Fusobacterium, if tamed, is fine. Just like us mother-in-laws, if we know when to leave, then we're beneficial. But it's when it overgrows. So I suspect that there's something in our environment that we can't quite pinpoint yet that is causing this pesky mother-in-law bacteria to overgrow. I don't have that broken yet, but boy, I'm researching this all the time.
Yeah. And you said, so for aggressive cases, you do treat with flagyl or metronidazole.
Hmm.
Um, but this one's come up a few times on GI stool testing, and usually like garlic, oregano can keep this under control. So, but it's tricky, like you were saying, for the fertility stuff, if no one is even looking at their microbiome, and then this is causing inflammation, because that's what these opportunistic bad guys do. They can cause inflammation if they're overgrown. So you think that inflammation probably in the fallopian tube was leading to the infertility in your patients?
I think that's certainly part of it. And it seems like to me that, it's this chronic inflammation, this inflammaging as people get older. And I know you're writing an incredible book on perimenopause. It seems to me that this oral inflammation, this low grade chronic inflammation, is sequestering the immune system and sort of tying it up. So once we clear that up, then our bodies are designed to heal. So at that point there are more resources to go to other areas to for those for the immune system to work.
Yeah. And when we look at in regards to fertility, I mean, I see this with patients all the time, even, not just bacteria in our in our gut and stuff, but stress, right? And your body, if you're stressed out, you're not going to want to heal, you're not going to want to get pregnant. But a lot of the times, these gut bacteria, the oral microbiome, that's causing a lot of stress on your body because it's chronic inflammation. And it's hard because it's like, what comes first? What do you fix first? And it's like all of it. No, but you have to work on like different layers at a time. And it might just look like getting a little scrubber, which I'm going to get for my kids because I think that they would have fun with that. So it might just be like, start taking good care of your oral health, and that will keep exposing more layers that you have to work on.
Exactly. And then your stress point is so on target because say when people are stressed out, if you're running from a tiger all the time, then your mouth is going to be more dry. And if your mouth is more dry, these bacteria can overgrow because saliva is so protective. And then so like you said, it's that circle. It's never one thing. Everything's impacting everything else. But this is an easy place to get started.
Yeah, yeah, that's great. So everyone listening out there right now, what could they do like today? What would you suggest, Dr. Debbie, today that someone can start on? Because they might feel overwhelmed a little.
Oh, that's a great question. I would say today get some little brush picks and there's again it's really tech you just want to scrub those teeth. I actually have an online course on my website, a very inexpensive course called Upstream Gut Health. I demonstrate all of this, but I would say start there. Now, know that your gums are going to bleed at first because they're inflamed. The gum picks do not make your gums bleed. Floss does not make anybody's gums bleed generally. It's because they're inflamed. So then, and on the course, I talk about questions to ask your dental team. You want to make sure they are reading the research and up on what's really important, what's impacting their health span. But start with the brushes. Start with simple and something you can hold, and it's not as tangly as floss, Dr. Jen. It's anybody can do it. Your
It's
children can
almost,
do it.
yeah, it's almost like a fidget. Think of it as like a fidget.
It is. It's like a, yeah.
Oh,
Well, and I jokingly here in Oklahoma, I'm like, all the cool people are doing it, because, we'll be out to dinner. My friends, they'll pull out their brush picks. It's amazing. You can brush and floss, and then you get a brush pick in there, and you're still like, whoa, there's a little broccoli in there. There's a little popcorn hole. It just really, scrubs it. The difference between, rinsing your tub out or scrubbing your tub.
oh yeah. That's like when kids try to do the chores and they just rinse, they don't scrub. Yeah, that's actually a good analogy. I should use that with my kids actually. Like take a pan and just rinse it and then scrub it and be like, this is why I just ordered some actually while we were on this podcast. This is why we're going to do scrub brushes because Dr. Debbie told us to, and it makes a lot of sense. The other thing I love is that like God created our body with symptoms and signs that something's wrong, right? And we ignore them. Like you were saying, the dentists that are like, oh, it's just a little bleeding. When is bleeding like ever not like, whoa, like fire, like let's check this out, let's hone in, right? So it's kind of cool that our gums bleed when they're inflamed because it lets us know that something's wrong. So listen to the clues. Don't stop pushing away the clues.
No, it's so right. God gave us all of these signs, like if you're a little headachy, maybe you're dehydrated. If you're a little, I mean, just on and on. But we start looking at these things as normal, Dr. Jen. And I always joke on my podcast about normal. Normal in our world is not a good thing. I mean, you're obviously not normal. I don't want to be normal because, normal is dehydrated, irritated, constipated, frustrated, overscheduled, overstimulated, undernourished, underrested, and totally stressed out. I mean, you can see that. Those are the patients that are seeing you that need your help. They've ignored these symptoms, but I fully agree. God gives us lots of signs. We just want to, and that's what your podcast is doing, helping people see the signs of things like, this might be so normal that I don't want it because normal's not good.
Right. Yeah. Be the weird ones. Be the ones that pull out digestive enzymes when you're out eating with friends and families. And then now I'm going to up it one more and bring out the dental picks.
And you've already ordered them. That is impressive. You've
Oh,
already ordered them.
I'm like, I needed them today. Like, I feel like if hey, you're the expert. If you're going to tell me something, and it makes so much sense too. Like, because those back molars just after a cleaning, I'm like, oh, I wish I could do this at home, but you can scrub the little things off. So I'm super excited. I just needed someone to tell me to get those. So thank you for that.
Oh, no, thank you. And you've got to see, folks, when you're watching this on video, it's one thing, but Dr. Jen is on a treadmill doing this podcast and she's listening so intently and coming up with these great questions. I'm just like, wow.
Well, I'm only going, what am I going at? 1.5. So, and
But you're
sometimes I put it down
moving.
to one. Oh yeah.
Ah,
Well, I will when I'm getting interviewed, I sit, but when I'm interviewing, I feel like I can walk. So, yeah. Anyway,
inspiring,
well,
very inspiring.
Dr. Debbie, how like so first of all, you don't look like a day over 40. You look amazing. So you're practicing what you're preaching. How can people work with you or just listen to you more?
Well, check out my website. I've got a lot of free information. If you love your dentist and you want to, and they say there's no research, I have a whole free research tab that I've curated. Um, I have this course. There's a link on my website. You can get the bristle health test through that. Just join me on Instagram and check out my podcast, Vitality Made Simple. Dr. Jen's going to be a guest soon, and we're going to learn all kinds of great things from her.
Yes. Well, awesome. It was so nice talking to you. Such good just information and you're just so sweet and positive. So super excited to have you here.
Thank you so much. It's just been my pleasure to be with you.